Okay, well, first of all, welcome to the conference. Can you tell us a little bit about yourself and about Kelvin Health and what brings you to Malta?
Thank you very much for having me here. So Kelvin Health actually is a medical device kind of thing that is doing analysis of the vascular system. So we can detect if you have any problems in the supply of blood in different zones of your body, which might actually be telling about severe conditions in your health. For example, blockage of your artery supply to the legs, some kind of oncology that increases the vascular supply there, or some kind of inflammation. So we are kind of coupling the old concept of thermography that has been used in the 70s and the 80s with the recent development in the area of medical imaging and AI, and producing a very accessible diagnostic tool.
And how important is it for this type of facilities to be accessible to patients?
So the problem with most diseases is that if you can catch them early, the outcomes for you as a patient are much better. But because of healthcare system functioning, logistics, stress of the current times, people typically are not getting to check themselves. Especially if there are not existent good, precise, non-invasive methods and you need to go under some kind of suffering or something, people
Okay.
will most likely delay the process of diagnostics. In some cases, it might be a financial issue or logistic issue or time issue, but in any case, if you have something that is widely accessible, most of those system disease and non-communicable diseases that are very tough, like cancer, like vascular pathology, if they are spotted early in the process, the prognosis is multifold times better for the outcome of healthcare outcome for the patient.
And Kelvin Health are offering their facilities to practitioners, to medical people. How is that working?
It's an interesting question. Our long-term vision is to have this even in the homes of all of us. We have this device, if it spots certain type of anomaly on our body, let's say when we are going to bed or to the bathroom or to take a shower or something, because our body needs to be naked, at least the part where we're doing the scan. So if we spot such kind of thing, this might notify your doctor or specialist, or if you're on some kind of therapy, the monitoring doctor. But this is our longest term vision. Our mid-term vision is to have this in the hands of the general practitioner, the family doctor in primary care. So especially people who are at the risk of developing certain conditions, they can be monitored non-invasively and rapidly without the need of a specialist on a relatively frequent basis. And our current stage is actually to provide this in the hands of the specialists. We're currently focused on two therapeutic areas. One is peripheral arterial disease, which basically means the blockage of the lower extremity of the legs, or breast cancer, which is very complex. It's much more complex than vascular pathology. And giving this as an assistive tool in the hands of the specialist so it can assist their existing diagnostic process and eventually be some kind of mean of rapid triage in the beginning of the patient journey.
And tell me, have you done some research as into how we are in Malta when it comes to using these type of facilities, or how accessible it is here in Malta?
So to be honest, we haven't been familiar with the healthcare system in Malta. One of the reasons we are coming here is to get a better understanding and a better grasp of how the healthcare system is functioning in primary care, secondary care, in hospital, etc. What we've heard already that the country is very oriented toward telemonitoring, at least has ambitions to telemonitoring, remote patient monitoring, telemedicine in general, which is a perfect fit for such type of solutions.
Because this morning we were speaking with both the Minister of Health and also the Minister responsible for aging and for the elderly, and it was a point of fact. We were talking about making things accessible for people to do checkups and screenings. Do you work with educational people as well to get your kind of information out there?
Yeah, so we basically are partnering with multiple patient organizations that increase the awareness about various types of conditions and what are the best practices for monitoring, for screening, for prevention of especially of cardiovascular disease and peripheral arterial disease. Also for breast cancer, we are partnering with multiple organizations for awareness. And this is because we just believe in the cause of preventive medicine, whatever the means for that are. We're just technical people by heart. We coupled ourselves with medical specialists and we wanted to build something that is super useful and accessible for wide screening and prevention as well.
And how important do you think conferences, this is your first time at this conference?
Yeah, in this particular conference, my first
How
time.
important are they to your business?
I believe that they're important from multiple perspectives. One obviously is the networking opportunity. You may meet a lot of different people you get exposure and visibility about the things that you're doing, and this is creating a lot of serendipities that are not actually that sporadic. They have been kind of concentrated because of this. The second important thing is typically if you have a conference at a specific date, you're typically pushing yourself to release something new or do something cool that you can demonstrate on the conference.
Okay, well, we wish you the best of luck. We hope that you become a part of our medical society here in Malta. I'm sure it's needed, and we hope to see a lot more of you guys.
Thank you very much.